episode of the Wyatt Sharp Show. Today, Minister Michael Tibolio, Ontario's Associate Minister of Mental Health and Addictions, is joining me. Hello, Minister. Welcome to the podcast, and thank you very much for taking the time to join me today.
My pleasure being with you.
So my first question is, why did you get involved in politics?
Well, I was a lawyer. I practiced law for 33 years. And in the process of doing that, I started working with young people that had mental health and addiction issues. So I did that for about 10 years. And one of the things I found back then was that there were not a lot of people that were able to provide supports and services for people with mental health and addiction issues. And a lot of the organizations that did exist were because of parents who cared about their kids weren't able to find help for them. So they started their own organizations to help kids. And I thought it was about time the government started investing and making sure that we put in place supports for people when they need them. And that's what I came to government for. I came to try to build that system. And that's what our government made the promise when we were elected, to spend $3.8 billion in investments for mental health and addictions. And I'm making sure that that money gets used for mental health and addictions in the province.
Okay, and so maybe for people who aren't familiar with you, did you get appointed as Minister of Mental Health and Addictions right away in 2018 when your party won, or did you get appointed, I believe, a year after when your party did a cabinet shuffle, or when did you get appointed?
That's right. I started off, I was a Minister of Community Safety and Corrections. So I looked after police, fire, and corrections. And then there I got to see mental health and the need for more supports. Then I became the Minister of Tourism, Culture, and Sport. And I learned the importance of sport for helping people with mental health issues, especially young people, get through some of the challenges in life through sport. And then I was appointed Minister for Mental Health and Addictions because we recognized that every decision pretty much that's made in government, so 16 ministries to be exact, have something to do with mental health and addictions. And so now at the cabinet table, there's someone that advocates for all the different ministries and for the people of the province of Ontario to make sure that we have a mental health and addiction strategy that's multi-ministerial, so across all the different ministries.
Okay, so we're seeing a big jump in drug addictions. For example, in last summer, the number of opioid deaths overtook the number of COVID deaths in the province of British Columbia. So, what is the government doing to ensure that mental health supports for Ontarians are there, and so that drugs don't necessarily become the alternative solution for people who are having trouble with their mental health?
So that's an excellent question. We created what's called the Roadmap to Wellness, and it's the plan for mental health and addictions in the province of Ontario. What we did was we looked over the lifespan. So, for instance, what do we do to help kids under the age of 12 in terms of education and being proactive so that they build up resiliency? What do we do with kids between 12 and 24, 24 and 45, age 45 and 65 and over? Because no matter where you are in the lifespan, you need supports for mental health and for addictions. In addition to that, we wanted to create a step care model. So no matter where you are in the province, you can have those supports. And of course, to deliver services in a way that's culturally sensitive. Those were the points that we wanted to make sure in the creation of the plan. Of course, like I mentioned before, a lot of the organizations that are doing the services are grassroots organizations that have to raise money by doing fundraisers. And that isn't acceptable when you think about the number of people that are suffering and how many people are dying as a result of the opioid crisis. So we are investing in building a connected, person-centered system to make sure that individuals get the supports they need and they don't fall through the cracks and end up overdosing or dying. And that's really the key that I play, is to ensure that we build that system over the lifespan, creating that step care model and making sure no matter who it is, that they get the supports they need. And I have a real strong emphasis on doing more for youth and children, because if we can prevent and teach resiliency to young people, we can reduce addictions by 25%. So our best investments are invest like you are. Okay.
So another question I have for you is we were just talking about mental health, and a positive thing for the mental health of Ontarians is we're beginning to see the reopening of the economy and lifting of the stay-at-home order. But how concerned should Ontarians be about having to go back to the grey lockdown level, um, for example, in hotspot regions like Toronto, Peel, and York?
Well, we're worried about the variants to the COVID-19 that are much more contagious. And so we're doing everything we can to make it as cautious as possible, the opening of the different segments of the economy. But we also recognize that part of mental health is getting you guys back in school. The most important thing is to make sure, especially young people, have the opportunity to be in a social environment that allows their minds, their cognitive abilities to develop. And you can't develop as well in front of a computer sitting at home. You really need to be engaged with other kids. So we wanted the schools open right away. And as of today, the schools are open. We need to also get people back to work and the businesses running, because it's putting a lot of stress on moms and dads. Because again, they're working from home. In a lot of cases, some are not working. It's causing financial impacts. It's also putting a lot of stress on the moms that are also, the teachers to the kids that are staying at home. So for us, we want to open up as quickly as we can, but we also have to be very cautious because of the variants of COVID-19 that are out there that could lead to another lockdown. And that's certainly something we don't want. And we believe if people are cautious and we all maintain the same rules that we've talked about from the beginning, so keeping our hands clean, using sanitizers, maintaining physical distancing, wearing the mask, these are all things that are really important. And all the testing that we're doing as well. In school now, there's the testing that it gives us results immediately to know if there is a problem through the contact tracing. We also know that if we do more from the standpoint of being vigilant, we should be able to get to the spring. And of course, when the spring comes and the summer comes, we'll be outside, less chance for spreading the virus.
Okay, so you mentioned the other variants, and a lot of the medical professionals are saying that if we do see a third wave of COVID, it's likely to come around April, and it's likely to be because of these COVID variants. And of course, there's multiple COVID variants now. I believe there's one from the UK, there's one from Brazil. So, um, just how much of a threat, and we kind of talked about this, but how much of a threat are like is the new COVID variants in terms of having to go back to lockdowns?
Well, we're concerned. We're extremely concerned. And that's why, if you heard Premier Ford the other day talk about the emergency brake, we're prepared, if necessary, to lock down again if we start seeing the numbers come up. We know for the last 4 days now, they've been under 1,000. So we know lockdowns work because we've seen the numbers come down quite dramatically in the time that we've been in lockdown. But we also recognize, like I said, how hard this has been on everyone, not only physically, but also mentally, having to stay inside and away from our friends and unable to go to restaurants and unable to go, shopping freely. But we recognize that the only way we're going to go forward is by taking very calculated and measured steps. And we've also empowered the public, the chief medical officers in each of the jurisdictions, in each of the areas in the province, the regions, to basically decide if they think in their region they need to shut down. So I think you're going to see, rather than big lockdowns or lockdowns throughout the whole province, that it may be more regional. And we're hoping that people will work with us to make sure that, we keep everyone safe. Because again, the health of everybody in the province is the most important thing for us.
Okay, and so you just mentioned the chief medical officer of health. So, for example, Stephen Del Duca, the Ontario Liberal leader, and then even Andrea Horwath, the Ontario NDP leader, have at times called for more enhanced lockdown measures. When even Premier Ford and members of your team say that you're following the advice of the chief medical officer of health. So, if you could say something directly to Andrea Horwath or Stephen Del Duca about them wanting additional lockdowns, what would you say to them?
Well, I think the reality here is that none of us came to government, and no one is sitting in opposition or as the third party in the House with a playbook in their hands that tells us how to deal under these very complicated and difficult circumstances. When you think about the size of the province of Ontario being France and Germany roughly, and a population of 24.5 million people spread over that jurisdiction, there is no one answer that works everywhere. And maybe, more intense lockdowns in the urban areas is something we can do. Maybe we can open up some of the other areas that are less populated. The reality of the situation is that we have to rely on our medical officers from the standpoint of providing us the best evidence and providing us with what we should be doing. To second guess them will either impact the economy in ways that may change the future of the economy in this province, or if we err the other way, it could overwhelm our hospitals, which is our biggest concern. So, what we've tried to do as a government, receiving the best information we can, is to try to balance those two huge interests that are very different. And that's what we're doing. So I basically say it's easy to sit in an armchair and be a quarterback. It's another thing to get in the game and have to throw those passes.
Okay. That's some good points. So the vaccine will be a crucial part to lowering the spread of COVID. When I had Minister Monty McNaughton come on my show, he pointed out that Premier Ford is calling the CEOs of vaccine companies to secure the vaccines for Canadians. Do you believe that this should be a responsibility of the federal government or of the provincial government?
Well, the coordination of the acquisition and distribution of the vaccines is federal. But I think if you meet Premier Ford, and if you haven't interviewed him yet, when you meet him or interview him, you're going to see he's the type of guy that doesn't like no as an answer. And he's the type of guy who thinks outside the box. So him contacting the presidents of the different vaccine companies and asking them for help or asking for more, he's doing that for the people of the province of Ontario because he genuinely cares. He's doing it because he's frustrated, as we all are, that the most critical part of our plan is to get as many vaccines into people's arms as possible, because we know that by doing that, we start to build what's called herd immunity. And with herd immunity, we can start getting our lives normalized somewhat. So, him reaching out, that's Doug Ford. And I think that's a great effort on his part. But at the end of the day, it's really not the responsibility of the province to be doing that directly. It should be the federal government. And of course, we've been working cooperatively with the federal government from the beginning, which has really made a huge difference from the standpoint of how well we've managed COVID-19 when we compare ourselves to other countries around the world.
Well, yeah, because a lot of Ontarians are impressed with that because liberals and conservatives don't tend to always get along too well with each other, but collaboration was definitely shown throughout COVID-19. So what is your government doing to implement health programs to combat the high suicide rates that we've seen in our province throughout COVID-19 and realistically across Canada?
So again, what we've tried to do through the roadmap to wellness is identify the issues that we need to deal with over the lifespan of individuals. One of the things that the pandemic has created is an urgency trying to deal with as many issues as possible on the virtual basis. So all of a sudden, we found ourselves delivering internet-based cognitive behavioral therapy. We found ourselves investing heavily in the kids' help phone line. We've invested heavily in creating other programs, Bounce Back and other programs that are available online. All these resources are there for the people of the province of Ontario, and they're resources that are good for young kids to seniors. And we even have helplines for seniors in multiple languages. So what we've tried to do is make sure that we could fit the needs of all individuals in the province, not within a one-size-fits-all, but create as many opportunities for people in the province to get the help they need that's adaptable and for them. So that's what we've tried to do with respect to suicide. That's an issue that's been around for a long time. I think the number is something like 500 or 600 people a month die of suicide somewhere in Canada, one every 40 seconds in the world. So these are serious numbers. And what we've tried to do there again is utilize whatever virtual supports we can. But we've also created help phone lines for kids and for anyone, a suicide hotline as well, to give as many supports as we possibly can. Because at the end of the day, we all need help sometime, and it's okay to ask for that help when you need it.
Okay. So we see COVID cases moving in a downward trend across the province of Ontario. But what can be done to keep cases low? Let's say maybe below 1,000 cases a day, like what we've seen, or obviously, in order for us to get to what many people are calling the new normal, it has to be lower than 1,000. But what can be done to lower COVID cases and not have a scenario like what we've seen? You know, in the summer, COVID cases went down, but then in the beginning of fall, they went up again.
Well, it's going to be a combination of a lot of different things, but first and foremost, it's education, like what you're doing now, asking for information as to what we can do, listening to the teachers, our parents, listening to each other, listening to the statements that are made by the medical officers. We know that it's a multi-pronged approach, right? You know, so when we talk about maintaining hygiene, proper hygiene, washing your hands as often as you can, but especially after you go out and you're playing or you touch a door handle, or you go to a store or someplace, ensuring that you wear a mask so that you're not breathing in the virus and potentially or giving the virus to someone. I hate to say this, but you know what? Your grandparents, see them on Facebook, on Zoom, utilize those methods to try to protect them at least until they have their vaccines. And even then, wear your mask when you see them. So that's important. The social distancing, we know that maintaining a physical distance between people, there's less of the chance for the COVID-19 to be given to you or for you to give it to someone. So maintain that social distancing. And remember that the other part of this whole package is that vaccine. When the vaccine becomes available, if you want it, we want to make sure that it's accessible. And the province, through General Hillier, has set up a logistical network that will allow for people to be vaccinated quickly. We're just waiting now for the different vaccines to become available, and we will be very aggressive to make sure that whoever wants a vaccine is going to get it. And I think a combination of all those things will get us to the point where at least we can keep the numbers below 1,000. And Wyatt, you know that below 1,000 is important for us because at the end of the day, it's not just a matter of how many people have COVID-19 or one of the variants. It's the ones that need to have supports in critical care or a ventilator in a hospital will not have access to those things if we overwhelm the hospital system. So what we're trying to do is make sure that we have enough capacity to help the people that are the worst off and not end up having to make a decision as to who we can help or can't help. And I think that's the most important part, that not the number of people with COVID, it's ensuring that there's enough capacity to look after the people that are in greatest need of that critical care.
Yeah, no, well, because a lot of the ICU capacity that is available is being taken up by COVID patients. So obviously, then we're seeing delays of surgeries and delays of many other things as well. But when do you believe all Canadians will be vaccinated for COVID? I mean, the federal government is saying September of 2021. Opposition parties are criticizing that. Even some medical professionals are saying that that is unreasonable, given that we've went weeks at this point without getting, or not weeks in a row, but there has been weeks that we've went without getting any doses of the COVID vaccine. So do you believe it is reasonable and responsible to say that all Canadians can be vaccinated by then? And do you personally believe that all Canadians will be vaccinated by September of 2021?
Well, I'm going to speak on behalf of Ontario. I can't speak on the logistical systems that are being built in other jurisdictions in Canada. But based on the numbers we have, the plan that was your consultation with the table, we are confident that if the vaccines are coming in other words, on a steady flow and on the basis of what we had been told originally, that we will be able to have everyone in the province of Ontario that wants to be vaccinated by the fall of this year. So you want to call it end of September, end of October, but in that time frame, everyone in Ontario that wants a vaccine will have one, provided the vaccines are flowing into the province at the rates that had been committed. Now, the good news is that right now we have two vaccines that are approved and that are coming into the province. The third one, AstraZeneca, I believe, was just approved by the World Health Organization today, and hopefully will be approved for use in Canada as well. And I believe that the more vaccines are coming in, the more vaccines are produced, the faster we'll get to the point of vaccination, at least to the 75, 85% level, which will give us herd immunity, which is what we're trying to get to, knowing that once we reach that, we should be able to maintain, we'll never get rid of COVID-19. It's always going to be with us. It's just going to become another flu, but we need to get to the point where the vaccines are in people's arms, we build herd immunity, and then at that point, any variants that may come forward will be tweaked with booster shots going forward. So unfortunately, this is something that's going to be with us the way the flu is, but I'm very confident. Personally, I'm very confident that if the vaccines are flowing, we will have herd immunity by the fall.
Okay, and so what can be done to get more young people involved in politics and civic engagement, and what can young people do? And actually, young people is the biggest demographic of people who watch my podcast. But what can be done to get more young people involved in politics?
Well, from my standpoint, getting more people like you asking questions of people like me, holding us accountable, but at the same time asking questions from your perspective is really important because at the end of the day, I think you're the youngest person ever to interview me. I've been interviewed by people from all over the province, all different cultures, and I think it's important that we hear from everyone. And I think if you start making an impression on politicians and politicians start listening to the things that you're asking them about and the ideas you guys bring forward, I think that'll get you more engaged because you're going to say, wow, they're actually listening to us. And that's important. I think that engagement, the conversations that take place, coming forward and getting involved, whether it be, and it doesn't matter what political stripe you are, getting involved with the local office of your constituency. Again, whether it's provincial, whether it's federal, whether it's municipal, shadowing an MPP or an MP or a minister or a municipal politician, going to some of the council, when we can go back to the council meetings or coming down to the House, we always welcome young people to come in and listen to the debates. Those are the kinds of things I think that are really important. Asking the questions and never, ever be shy to ask questions. I can remember the only things I ever regretted when I was your age was not asking the questions because I was given many opportunities, with a couple of prime ministers, many ministers, and I was always shy to ask the questions or to engage. But you know what? We all respect each other. And I'm always happy to listen to young people, especially when they come forward, because to me, that's my future. You guys are going to take over our positions one day. And we need to make sure that you understand what the issues are. And we need to make sure that you're engaged, because at the end of the day, you'll be making the decisions, not just for me, but for my kids and my future grandchildren. So it's really important that we engage and we communicate with each other. And I welcome you and anyone listening to this podcast. My office doors are always open up in Vaughan Woodbridge. You can contact, you can come in, you can hang out, you can do some volunteer work, you can, door knock, you know what, there's so many things that you can do. And not necessarily just with me. Like I said, anyone that you would call of the politicians would welcome young people into their offices to help them understand and develop the skills that will help them later on in life.
Okay, yeah. I'm actually having the premiere on my podcast next week. But yeah. So my final question for you today is: why should the people of Vaughan Woodbridge vote for you in the next election?
Well, I came to politics not because I'm a politician. I came to politics because I'm an advocate. And an advocate is a person who listens to a group of people and does everything in his power to try to make a difference, him or her make a difference. For me, I've always been very interested in mental health and addictions. I've spent 40 years of my life doing that. I'm actually doing my doctorate right now in clinical psychology in the area of mental health and addictions. And I started the roadmap to wellness. I spent a lot of my time writing it and thinking about it. I've only been here 2 years to really start the implementation of it. And if I'm lucky enough to be elected by the people of Vaughan Woodbridge, I hope to come back and finish the work that I started, which is the implementation strategy. Anyone in the province of Ontario who has a mental health addiction issue gets the help he or she needs where they live, and ensure that the future of all Ontarians includes help when it comes to their mental health and addiction, something that no government in the past has ever invested into the level we have, nor has any government in the past ever given it the credence of having a minister responsible for the mental health and addiction. So I'd like to come back and continue the work that I started.
Okay, great. Thank you so much, Minister, for coming on my podcast today to discuss all of these important issues.
My pleasure, Wyatt, and I look forward to seeing the podcast once it's up and running. Thank you.
Thank you.